Welcome to our deep dive into community-based nursing.
Okay.
We've got some fascinating excerpts from a nursing textbook, perfect for anyone who's either studying nursing or working out in the field.
Yeah, I think it's a really important topic, especially these days.
Yeah, absolutely.
And it's a field that's constantly evolving.
Right.
And it goes way beyond what we typically think of as community health.
Okay. Yeah, that's a good point.
So I'm excited to dig into this.
Me too. So we're going to unpack what community-based nursing really entails,
Yeah.
how it differs from other types of care, and what kinds of challenges and rewards nurses face in this unique setting.
Right.
And we're going to bring those textbook concepts to life with some real-world examples.
Absolutely, because I think that's what really brings it home for people.
Yeah.
You can read about something in a textbook, but until you see it playing out in someone's actual life, it's hard to really grasp the impact, It's about understanding vulnerable populations, mastering the art of care coordination, and even navigating some surprising ethical dilemmas.
I'm intrigued already. So let's lay the groundwork.
Okay.
What exactly is community health?
Well, it's a broader concept than you might think.
Okay.
It's not just about physical well-being.
Okay.
It's about creating communities where everyone has the opportunity to thrive.
So we're talking about access to things like healthy food, good schools, safe housing,
Right, exactly.
all those factors that play a role in overall health.
Exactly, all of those social determinants of health. And on a national level, there's an initiative called Healthy People 2030 that sets objectives for improving the health of the entire U.S. population.
Okay.
And within that, there's a subset of high-priority goals called leading health indicators, which focus on addressing major causes of death and disease.
Oh, that's interesting.
Yeah.
So there's this big picture view of community health.
Right.
But how does it translate into nursing practice? The textbook makes a distinction between community health nursing and community-based nursing.
Yes. And that's a key difference, and it can be confusing.
Okay.
Community health nursing looks at the health of an entire population, while community-based nursing is all about the care of individuals and families.
So it's like zooming in from the wide lens
Right.
to a close-up on individual patients.
Exactly. And this care happens wherever people are: homes, schools, workplaces, even places of worship.
So we're talking about a really diverse range of settings and patient needs.
Right, and that's why community-based nursing has become much more specialized over the years.
Makes sense.
You've got specialties like enterostomal therapy, cardiac care, mental health, maternal child health, palliative care. The list goes on.
Yeah, it makes sense that you'd need specific expertise to handle those kinds of complex cases outside of a hospital setting. So we're starting to get a picture of how broad this field really is.
Yes.
But what does it actually look like in practice?
Well, before we jump into a specific example, it's important to understand that community-based nursing, while incredibly rewarding, also comes with unique challenges.
Yeah, you're right. It's not all sunshine and roses.
Right, it's not always easy.
What kind of obstacles might nurses encounter in this setting?
Well, think about it. You're often dealing with limited resources, complex family dynamics, and patients with multiple chronic conditions.
Okay.
You need a high level of autonomy, critical thinking skills, and the ability to adapt to constantly changing situations.
And I imagine it can take an emotional toll working with vulnerable populations who are facing difficult circumstances.
Absolutely.
Wow.
So with that in mind, let's dive into a story about a nursing student who was assigned to care for a premature baby named Joey.
Oh.
This will give us a real-world glimpse into both the challenges and rewards of community-based nursing.
Okay, so this baby Joey was discharged home with some pretty complex needs.
Right, and this is a great example of how the lines between hospital and home care are blurring. In the past, a baby with Joey's needs would likely have stayed in the hospital much longer.
The textbook mentions that Joey was still being fed artificially, was on a ventilator, and needed round-the-clock care.
Right.
That sounds incredibly challenging, even for an experienced nurse, let alone a student.
It was a real trial by fire.
Wow.
And the textbook really captures the student's feelings of being overwhelmed and unprepared.
Yeah.
She even considered asking to be reassigned to a different patient.
I can't say I blame her.
Right.
It's a natural human response to feel intimidated in a situation like that.
Totally.
But what happened? Did she back down from the challenge?
No, she didn't, and that's what makes this story so inspiring.
Okay.
She decided to push herself and seek guidance from a more experienced mentor.
Good.
She recognized that this was an incredible learning opportunity, even if it was scary.
That's a great takeaway for all of us, whether we're students or seasoned nurses.
Yeah, I agree.
We shouldn't let fear paralyze us. Sometimes you have to embrace the challenge and seek support when you need it.
Exactly.
And in Joey's case, the student's willingness to learn paid off.
It did.
With the help of her mentor, she gained the skills and confidence to provide safe and effective care for Joey at home.
That's great.
And maybe even more importantly, she helped Joey's mother feel comfortable and capable in her new role as a caregiver.
Yeah, I think that's such an important piece of it, too.
Yeah.
Supporting the family as well.
That's a fantastic outcome.
It is.
It sounds like this experience was transformative for both the student and Joey's family.
I think so.
It highlights the ripple effect that good nursing care can have.
It really does. It goes beyond just the patient themselves.
And it leads to a question for our listener.
Yeah.
Have you ever felt overwhelmed or out of your depth in a clinical setting?
It happens to all of us.
What helped you navigate that feeling?
I'm sure we all have different strategies.
That's something we can all relate to no matter where we are in our careers.
Right. It never really goes away.
Sometimes just admitting that you're struggling and reaching out for help can make all the difference.
I think that's so true. It can be hard to ask for help, but it's so important.
We can't do this alone.
It can't, that's for sure.
Collaboration and mentorship are essential in nursing, especially in a community setting where the challenges can be so unique.
Absolutely.
So beyond personal growth, what are some of the specific roles that a community-based nurse might play?
Well, the textbook highlights 3 key roles: patient advocate, coordinator of services, and patient and family educator counselor.
Let's unpack those a bit.
Okay.
What does it mean to be a patient advocate in the community setting?
Well, it means being a voice for your patients and helping them navigate the often confusing and complex healthcare system.
Okay.
It might involve helping them understand their insurance coverage, connecting them with community resources, or even advocating for their needs with other healthcare providers.
The textbook gave an example of a nurse advocating for continued home health services from an insurance company. It sounds like you need to be pretty tenacious to be an effective advocate.
It definitely requires some assertiveness and a deep understanding of how the system works. But ultimately, it's about protecting your patient's best interests.
Okay.
And that brings us to the role of coordinator of services.
So what does that entail? It sounds pretty involved.
It is. It's all about making sure the patient receives the right care at the right time from the right providers.
Yeah.
It's like being the conductor of an orchestra, making sure everyone is playing in harmony.
That sounds like a real juggling act.
It can be.
The textbook mentioned understanding the roles of other healthcare professionals, like social workers and therapists, and connecting patients with community organizations, like Meals on Wheels or the American Cancer Society.
Exactly. You need to see the big picture and understand how all the different pieces of the puzzle fit together to provide holistic care.
So I'm curious, how would you go about finding the right community resources for your patients?
Oh, that's a great question. It highlights the importance of networking with other professionals and staying informed about what resources are available in your area. It's also about being resourceful and creative in your approach.
Okay.
Sometimes you have to think outside the box to find solutions.
Yeah, that's a good point.
Now let's move on to the final role mentioned in the textbook: patient and family educator counselor.
This one seems pretty broad.
It does encompass a lot.
Yeah.
You're teaching patients and families about everything from disease processes and treatment options to medication management and wound care.
Right.
You're essentially empowering them to take control of their own health.
And it's not just about handing them a pamphlet.
Right. Exactly.
The textbook emphasizes that effective teaching goes beyond simply providing written instructions.
Yeah, it has to be tailored to the individual.
You need to tailor your approach to each individual patient and family, taking into account their learning styles, cultural backgrounds, and literacy levels.
Absolutely.
It's about building relationships, establishing trust, and meeting people where they are.
Right.
And sometimes it's about providing emotional support in counseling, too.
Oh, absolutely. You're often entering people's homes during very stressful times, so it's about bringing empathy and compassion to the table alongside your clinical expertise.
Makes perfect sense.
Yeah.
And that leads us to another crucial aspect of community-based nursing: ensuring continuity of care.
Right. That's a big one.
What exactly does that involve?
It's all about making sure transitions between different care settings are seamless, and that information is effectively communicated between providers.
Okay.
Think about a patient being discharged from the hospital to home, or even moving between different units within a hospital.
Right.
The nurse plays a key role in making sure there are no gaps in care.
So clear and concise communication is critical here.
Absolutely crucial.
And there are specific communication tools that can be incredibly helpful in these situations,
There are.
like SBR and ISBARQ.
Yes, those are great tools.
Okay, let's break those down.
Okay.
SBR stands for Situation, Background, Assessment, and Recommendation. And ISBARQ simply adds introduction and question and answer to that framework.
Exactly, just building on that basic structure.
These tools provide a structured way to communicate essential patient information concisely and effectively.
I think they can really help to prevent things from getting missed,
Yeah,
which can be so important, especially in these complex situations.
the textbook gave some helpful examples of SBR scenarios, like communicating a patient's pain level or lack of social support to other members of the healthcare team.
Right, so let's say you're calling a physician about a home hospice patient who is experiencing uncontrolled pain.
Oh.
You would start by introducing yourself and clearly stating the situation. The patient is in obvious discomfort, grimacing and moaning.
Okay.
Then you'd provide some background information. The patient is in end-stage breast cancer and her family has been told that death is imminent.
Okay.
Then you'd present your assessment of the situation. You've observed that the daughter has been administering the prescribed pain medication as ordered, but it's no longer effective. And finally, you'd make a recommendation, perhaps suggesting that the palliative care provider reevaluate the patient's pain management plan.
Using this structured format ensures that everyone is on the same page.
Right.
And that important details don't get lost in translation.
It's really helpful.
It's crucial for preventing medical errors and ensuring patient safety.
Absolutely.
The Joint Commission has even identified 5 specific causes of communication breakdowns, which they illustrate in a helpful diagram.
Oh, that's interesting.
They highlight things like lack of information, misinterpretation of information, failure to respond to information, information overload, and lack of accountability.
It's amazing how many things can go wrong in the communication process.
It's crazy.
Isn't it?
It really underscores the need for clear, concise, and timely communication in healthcare.
Right, and I think especially in community-based nursing, where you're often dealing with multiple providers in different settings, it's even more crucial.
It definitely gives us all something to think about.
It does.
How has communication or miscommunication impacted patient care in your experience?
Oh, that's a question that deserves some reflection. I'm sure we all have stories to share about how effective communication, or the lack thereof, has shaped our experiences as nurses.
Definitely, but I think we'll save those stories for another time.
Yeah, maybe we can do a whole deep dive on communication.
Absolutely, I think that's a great idea.
Because it's so central to everything we do.
It really is.
But for now, let's take a pause here for the end of part 1 of our deep dive.
Okay.
We'll be back in part 2 to delve deeper into the complexities of care coordination and explore the unique needs of vulnerable populations.
Sounds good. I'm looking forward to it.
Me too. Stay tuned. Welcome back to our deep dive into community-based nursing.
We covered a lot of ground in part 1, from the core principles of community health to the unique challenges and rewards of working with patients like baby Joey.
Right, we talked about how it's not just about providing medical care.
Yeah,
It's about so much more. It's about understanding the whole person, the whole family, the whole community.
And now, in part 2, we're going to delve into the complexities of care coordination
Okay.
and explore the unique needs of vulnerable populations.
I'm excited to talk about this. It's something I'm really passionate about.
Me too. So the textbook introduces the concept of a care coordinator,
Right.
someone who plays a central role in helping patients achieve their health goals.
Yeah, they're kind of like the quarterback of the care team, making sure everyone is on the same page and working together.
And the textbook emphasizes the importance of expertise in self-management support, patient advocacy, navigating complex systems, and of course, strong communication skills.
Right, because you're dealing with so many different moving parts.
So it's like being a patient advocate, a resource navigator, and a communication guru all rolled into one.
Yeah, it's a lot.
It seems like communication really is at the heart of effective community-based nursing.
It really is. You can't overstate the importance of communication in this field.
Now, the textbook also briefly mentions the role of a patient navigator,
Yes.
particularly in the context of oncology care.
Right.
Is that different from a care coordinator?
Yes, although there can be some overlap.
Okay.
A patient navigator might be a nurse,
Okay.
but they could also be a social worker or even a layperson.
Interesting.
Their primary focus is on the support aspects of care.
Okay.
Things like scheduling appointments, assisting with financial assistance applications, providing psychosocial support, and connecting patients to community resources.
So while a care coordinator might have a more clinical focus, a patient navigator is there to help patients navigate the healthcare system and address any barriers to care they might encounter.
Exactly.
And that brings us to an important topic:
Yeah.
vulnerable populations.
Right, and I think this is where community-based nursing really shines because it's all about reaching those who are most in need.
The textbook defines these as groups of people who face barriers to accessing healthcare due to a variety of factors.
Right, it's not just one thing, it's often a combination of things.
They give examples like people with disabilities, mental illness, substance use disorders, ethnic or racial minorities, those experiencing poverty, and undocumented immigrants.
And it's important to remember that these categories aren't mutually exclusive.
Right.
Someone could be facing multiple barriers at the same time.
Yeah, what's fascinating is how these factors can intersect and create even greater challenges for individuals.
Exactly, you're absolutely right.
Imagine someone who is struggling with a mental illness and experiencing homelessness.
Right, it's like a domino effect.
The barriers they face are compounded,
Yeah.
making it incredibly difficult to access the care they need.
That's why it's so important for us as nurses to be aware of these potential barriers and to advocate for our patients.
It's a heartbreaking reality.
It is, but it's also a call to action.
The textbook shares a brief story about Mrs. Saxa, a woman with heart failure,
Right.
who's navigating a complex healthcare system, highlighting the potential for communication breakdowns between providers.
And that's a huge problem, especially for patients who are already vulnerable.
It's a powerful reminder of how easily things can slip through the cracks,
Yeah, it's scary to think about.
especially for patients who may not have the resources or knowledge to advocate for themselves.
So it really puts the onus on us as nurses to be extra vigilant.
It makes you realize how important it is for nurses to be aware of these potential pitfalls and to step up as advocates for their patients.
Absolutely, we have to be their voice.
So how can nurses ensure that all patients receive equitable care regardless of the challenges they face?
Well, I think it starts with awareness.
Okay.
We need to be mindful of our own biases and assumptions.
Right?
And educate ourselves about the unique needs of different populations.
And use our voices to advocate for systemic change.
Yes, exactly. We can't just accept the status quo.
It's about creating a more just and equitable healthcare system for everyone.
That's the ultimate goal.
Now, let's shift our focus to the rapidly growing world of home healthcare. It's an area that's seen significant growth in recent years,
It has, and I think that trend is only going to continue.
and it's only going to continue expanding.
I agree.
The textbook attributes this growth to several factors, including an aging population, earlier hospital discharges, and a growing preference for dying at home.
Right, people are living longer,
Yeah.
and they want to be able to stay in their homes as long as possible.
It's a trend that's likely to continue as technology advances and healthcare delivery models evolve.
Absolutely, we're seeing so much innovation in home healthcare these days.
The textbook mentions the diverse range of services provided in home healthcare settings, from high-tech services like IV therapy and skilled professional care to custodial services, hospice care, and community support.
It's really a wide spectrum of care, and it
Yeah.
requires a very specialized skill set.
It sounds like an incredibly dynamic and challenging field.
It is. It's definitely not for everyone.
What are some of the unique challenges nurses face when providing care in a home setting?
Well, I think one of the biggest challenges is the environment itself.
Okay.
You're not in a controlled hospital setting.
Right.
You're in someone's home, which comes with its own set of variables.
And I imagine that can make things like infection control and safety a bit more complicated.
Absolutely. You have to be much more adaptable and resourceful.
The textbook talks about the importance of patient and family education in the home setting.
Right, because you're often relying on family members to take on the role of caregivers.
Which means you need to be skilled at teaching them how to safely and effectively provide care.
Exactly. You're not just caring for the patient, you're also educating and supporting the family.
And that can be a lot to ask of families, especially if they're already feeling stressed and overwhelmed.
It can be a huge burden.
The textbook emphasizes the emotional and logistical challenges faced by family caregivers.
It's not easy being a caregiver.
They're often juggling multiple responsibilities, dealing with financial strain, and coping with the emotional toll of caring for a loved one.
And it can be very isolating.
Yeah, it's a hidden burden that many people face.
And one that we as nurses need to be sensitive to.
The textbook even shares a personal anecdote from a nurse who struggled to care for her own husband after surgery.
Oh, wow. That's powerful.
It highlights the hidden difficulties even experienced nurses can encounter when they become caregivers themselves.
It just goes to show that anyone can be a caregiver.
Right.
And it's not always easy.
It's a powerful reminder that we need to be mindful of the challenges faced by both patients and their families.
Yeah, we have to remember that the family is part of the care team, too.
So how can nurses best support both patients and their families in the home setting?
Well, I think it starts with communication.
Okay.
We need to be really good listeners.
Okay.
And make sure we're understanding the family's needs and concerns.
And we need to be clear and concise in our instructions.
Right. We don't want to overwhelm them with information.
And be advocates for our patients and families, helping them connect with resources, navigate the healthcare system, and find solutions that work for their unique situations.
Yeah, we have to be their champions.
It's about empowering families to feel confident and capable in their caregiving roles.
Exactly. We want them to feel like they're part of the solution.
Now let's talk about another crucial aspect of home care: safety,
Okay.
both for the nurse and the patient.
That's a big one.
You're absolutely right.
We have to be mindful of our own safety as well as the patient's safety.
When you're entering someone else's home, you need to be aware of potential hazards
Yeah.
and take steps to protect yourself.
Right. You never know what you're going to walk into.
The textbook stresses the importance of safety assessments during home visits.
It's essential.
This includes things like being aware of your surroundings, being cautious about entering unfamiliar homes, and having a plan in place in case of an emergency.
Right. You have to be prepared for anything.
It's all about being prepared and using common sense.
Exactly. Trust your gut.
And on the flip side, you're also responsible for ensuring the patient's safety in their home environment.
Right. We have to be their eyes and ears.
That means identifying potential hazards and working with the family to mitigate those risks.
Things like fall prevention, medication safety, and infection control.
The textbook highlights the importance of infection prevention in home care.
Especially for vulnerable patients who may be more susceptible to illness.
So we're talking about things like teaching family caregivers proper hand-washing techniques, the use of personal protective equipment, and safe waste disposal.
And making sure they understand why these things are so important.
It's about empowering families with the knowledge and skills they need to create a safe and healthy home environment.
Absolutely. We're not just there to provide care, we're also there to educate.
Now let's talk about the process of transitioning patients out of home care, which often involves discharge planning.
Right, and this is where the nurse's role as a care coordinator is really crucial.
This is where the nurse's role as a care coordinator is especially important.
Yeah, because you're essentially orchestrating the whole transition.
You're responsible for assessing the patient's ongoing needs, setting realistic goals, providing thorough teaching, making referrals to other providers or community resources, and evaluating the effectiveness of the discharge plan.
And it all has to be tailored to the individual patient's needs.
It's a cyclical process that requires constant assessment and adjustment.
You're constantly reassessing and making changes as needed.
The textbook outlines some specific criteria that might indicate the need for formal discharge planning and referrals.
Okay.
Things like lack of knowledge about the treatment plan, social isolation, newly diagnosed chronic disease, major surgery, prolonged recovery, emotional or mental instability, complex home care regimen, financial difficulties, lack of appropriate referral sources, or terminal illness.
Wow, that's quite a list.
It's a comprehensive list that emphasizes the need for individualized discharge planning.
Right, there's no one-size-fits-all approach.
We need to take into account the unique circumstances of each patient and family to ensure a smooth transition.
It's all about meeting them where they are and making sure they have the support they need.
Now let's talk about a situation that can sometimes arise during discharge planning. Patients leaving against medical advice, or AMA.
Okay.
This can be a challenging situation that raises both ethical and legal considerations.
It definitely can be tricky.
The textbook provides some advice for nurses working with patients who choose to leave AMA,
Right.
including thoroughly documenting the patient's reasons for leaving and ensuring the patient understands their rights and responsibilities.
Yeah, it's important to have those conversations.
It's important to remember that patients have the right to make their own decisions about their care, even if those decisions go against medical recommendations.
Right. We can't force them to stay.
However, it's our duty as nurses to ensure they're making informed decisions and to advocate for their safety and well-being.
Exactly. We have to respect their autonomy while also trying to protect them.
That's a delicate balance.
It is, but it's one we have to navigate.
We need to respect patient autonomy while also providing them with the information they need to make safe choices for themselves.
And sometimes that means letting them go, even when we don't agree with their decision.
And with that, we'll wrap up part 2 of our deep dive.
Okay.
In Part 3, we'll explore the transformative potential of telehealth and discuss how this rapidly evolving technology is shaping the future of community-based nursing.
Sounds good. I'm looking forward to it.
Stay tuned. Welcome back to the Deep Dive. We've spent Parts 1 and 2 exploring the multifaceted world of community-based nursing.
Yeah, it's been quite a journey.
From its core principles and the challenges nurses face to the importance of care coordination and working with vulnerable populations.
Right. We've covered a lot of ground.
And now, in Part 3, we're turning our attention to a real game changer in the field.
Okay.
Telehealth.
Yes. Telehealth is definitely shaking things up.
It's absolutely exploded in recent years, especially since the pandemic.
It really has.
It's hard to imagine healthcare without it now.
It's become so integrated.
But what exactly is telehealth, and how is it transforming community-based nursing?
Well, the textbook defines telehealth, sometimes called telemedicine, as using electronic information and telecommunication technologies to provide care remotely.
Okay.
So it's essentially healthcare without needing to be physically present in the same location.
So we're talking about things like virtual doctor's visits, remote patient monitoring, and even securely messaging with healthcare providers electronically.
Exactly. It's all about leveraging technology to bridge the distance between patients and providers.
And one of the most appealing things about telehealth is that it can be done using devices that most people already have.
Right. You don't need any fancy equipment.
Smartphones, tablets, laptops.
It's all very accessible.
It's breaking down geographical barriers
Yeah.
and increasing access to care for people in rural or underserved areas
Absolutely.
who might otherwise struggle to see a specialist.
It's really a game changer for those populations.
The textbook mentions several key benefits of telehealth, including limiting physical contact, increased convenience, and expanded access to those specialists.
Right. And I think that's especially important for patients who are homebound or have mobility issues.
Yeah.
It can really improve their quality of life.
And let's not forget the potential cost savings.
That's a huge factor, too.
Telehealth can reduce the need for unnecessary trips to the doctor's office or the emergency room, which saves patients both time and money.
Right. It's a win-win for everyone.
So it makes it a win-win for both patients and providers, right?
In many ways, yes.
Okay.
Of course, like any new technology, there are challenges to implementing telehealth effectively and equitably.
Right. I imagine there are some kinks that still need to be worked out.
There are definitely some growing pains.
But its potential to revolutionize community-based nursing is undeniable.
I completely agree. It's already having a profound impact.
That brings up an important point.
Okay.
How can we ensure telehealth is being used ethically and equitably so that everyone benefits from its potential?
That's a critical question. I think we need to be mindful of digital literacy and access disparities.
Right. Not everyone has equal access to technology.
Exactly. And not everyone is comfortable using technology.
We have to make sure telehealth technologies are designed to be user-friendly and accessible to all patients,
Absolutely.
regardless of their tech skills or resources.
I think simplicity is key.
We don't want to create a new set of barriers to care in the process of trying to expand access.
Right. That would defeat the whole purpose.
It's a constantly evolving field, and we're still learning about the best ways to integrate telehealth into community-based nursing practice.
I think it's going to be really interesting to see how things evolve.
But it's an area full of potential.
It definitely is. It's an exciting time to be in nursing.
So after taking this deep dive into the world of community-based nursing, what are some of the key takeaways we should keep in mind?
Well, I think we've learned that community-based nursing is a dynamic and evolving field that requires a unique set of skills.
Right, it's not your typical hospital setting.
It's about far more than just medical care. It's about advocating for patients, coordinating resources, building relationships, and empowering families to provide safe and effective care at home.
It's about meeting patients where they are,
Exactly.
both literally and figuratively.
And understanding the complex interplay of factors that influence their health and well-being.
Yeah, it's a holistic approach.
And what I find so fascinating is that community-based nursing is constantly evolving. With the rise of telehealth and other innovative technologies, nurses are finding new ways to reach patients and provide care in ways we never imagined before.
It's amazing to see how much the field has changed even in just the past few years.
It really is, and who knows what the future holds.
It's exciting to think about what the future holds for this vital and dynamic field.
It certainly is. There's so much potential.
And as we move forward, it's important to keep asking ourselves how we can continue to adapt and innovate to meet the changing needs of our communities.
I think that's a great takeaway. We have to be willing to embrace change and be open to new ideas.
We hope this deep dive has given you a renewed appreciation for the vital role community-based nurses play in shaping the health of individuals, families, and entire communities.
It's a challenging but incredibly rewarding field.
Keep learning, keep exploring, and keep advocating for your patients.
You're making a real difference out there.
And that's a wrap on our deep dive into the world of community-based nursing. We'll catch you next time for another insightful journey into the heart of healthcare.
Thanks for listening.